Um, so as Felicia mentioned, I'm currently working on the Student Psychological Intervention Trial, otherwise known as SPIT. And it was actually named SPIT by one of our student advisors. And as people here know, I mean, you are obviously really, really interested in student mental health and well-being. And globally, there has been a lot of interest in the prevalence rates, etc., and a lot of concern about the high rates of mental illness among university students. And back in 2015, we conducted what was known as the the Ulster University Student Wellbeing Study. And from that, now we had a sample of about 700 students, but from that, we then went ahead and applied to get a large-scale grant to try and conduct some more research into student wellbeing, not just in Ulster University in Northern Ireland, but also in Letterkenny Institute of Technology in the Republic of Ireland. And we received quite a large grant from Kyten to conduct a two-phase cross-border project between Ulster University, as I said, in Northern Ireland, and Letterkenny Institute of Technology in the Republic of Ireland. And this two-phase project started in September 2019, just prior to the pandemic, or the year prior to the pandemic. And you'll see from our slides, we had lots of students involved throughout, and it was really, really beneficial for the study. This is the phase one of the study, where we were out recruiting students to complete a large-scale survey. So the survey we aimed to recruit in the region of 2,000 first-year undergraduate students, and we were going to follow them up then throughout their time at university. Now, phase one of the study was, as I said, a large-scale survey that was conducted as part of the World Mental Health International College Student Initiative. And we were very, very lucky to be involved in this consortium. It's led by researchers from Harvard University. So in phase one, as the students had just registered, we literally grabbed them on the campus. We asked them to provide consent. We took a small saliva sample from them, hence the name SPIT. And we conducted the survey. Now, the survey was online, and it was a validated instrument, the World Mental Health CD. So it is clinically relevant diagnosis and symptoms of depression, anxiety, etc. So in year one, we had over 1,800 fully completed responses, and that's the findings from that is what I'm going to present to you today. In year two, which was during the pandemic, we had over 900 fully completed responses, and in year three, we had over 700 fully completed responses. So we do have really, really interesting longitudinal data there following this cohort, which was particularly interesting because of the pandemic. So what did we find? So first of all, when we looked at the data, we used weights. Colleagues in Harvard created algorithms, and they provided us with weights based on the general population in relation to age and gender of the student population in both institutions. And we found that nearly 16% of participants, or students that were just starting university, were coming in with like 16% of depression, nearly 9% had panic disorder, nearly 4% bipolar disorder, and over 11% were saying that they had alcohol use disorder or screening positively for drug abuse or dependence. Now, when people talk about student mental health, they often think that, mental health deteriorates when students are at university, But what we were actually finding was that students were coming in with a lot of pre-existing problems, as you'll see here. Of great concern to us, we asked a number of questions in relation to suicidal behaviour. And 28% of students said that in the years prior to starting university, at some point in their life, that they had serious thoughts about killing themselves. Over 14% had made a suicide plan. Over 13% said that they engaged in self-harm. And what was really striking was 7.7% of students said that they had attempted suicide at some point prior to starting university. And when we looked into this further, quite a lot of these was more than one attempt. Now, built into the survey, we had what we called like a high risk alert. And if students responded in a certain way to the suicide questions, they triggered this alert. And their details were passed on to student wellbeing or an accredited counsellor in LYIT. And overall, 144 students were followed up, and a lot of them received the support that they needed. But the big thing was that we really wanted to highlight that the support services were available to them should they need help. We looked at a number of risk factors. So just very briefly here, we found that females had higher rates of depression and self-harm, whereas males had higher rates of drug dependence. In relation to age, students that were over 21, for example, were more than 2.5 times more likely to have lifetime depression or drug dependence. And they were also more likely to have a suicide plan or to have attempted suicide, but there was no significant difference for self-harm. Non-heterosexual students were at a heightened risk. They were between 2 and 3 times more likely to have a range of mental health problems or suicidal behaviour. Students that weren't married had higher drug dependence, suicide plan, and self-harm. And I've just completed a paper, it's out for review at the moment, where I looked at courses, and we were finding that a lot of students on some courses seemed to have higher rates of mental health problems than others. And, that they were, now, it wasn't that, as I said earlier, sometimes people think some of these courses are stressful and that's why they have mental health problems. But what we were finding was that people seem to be drawn to these courses. For example, psychology, law, and art in particular had very high levels of mental health problems. We also looked in that paper at help-seeking behaviour, and a lot of students were saying that they were reluctant to seek help because they were afraid that it would impact on their career, particularly the likes of nursing, mental health nursing students, and psychology students. And we asked them for some reasons as to why they wouldn't look for help. A lot of them said that in addition to the stigma around it, that they wanted to handle the problem on their own, or that they would talk to friends or family about it. And others said that they were unsure where to get help. And again, in the years prior to starting university, we were trying to figure out, right, how many of them had actually had help in some form or another for their mental health problems. And 23.1% said that they had received counselling, significantly more females than males, which tends to be found anyway. And with females much more likely to look for help than males. And 13.1% said that they had taken medication for an emotional problem at some stage, again, significantly more females. But what was really concerning was only 5.4% of participants said that they were currently receiving treatment. And if you think of the high prevalence rates that I reported there, that is concerning. So phase 2 of the SPIT project, we were really trying to see, right, what can we do to help students, particularly those that are reluctant to look for help from traditional sources, such as college counselling services. So we we're trialling an online CBT-based guided intervention, which was designed by Pim Kuipers and Helene Ripers and colleagues at VU Amsterdam. And the aim of this was really to try and see if it would reduce symptoms of mild to moderate levels of anxiety and depression, and if students would like it. So the intervention consists of 7 online sessions, and it lasts between 45 and 60 minutes, and written support was provided from trained guides. Now, a lot of these guides were actually master's students from psychology, and they really, helped us with this intervention. And they provided written support via the online platform to the participants. And the platform, just to let you know, was available 24/7, so students could avail of it whenever they wanted. So then we conducted a qualitative study to gain insights into the unique factors associated with delivery and the success of the intervention. This was carried out by an independent mental health charity. And we also conducted a quantitative study to assess the effectiveness of the intervention. So for the intervention itself, we had 35 students on the intervention group and 36 in the control group. And the students, after they'd completed a number of different questionnaires, including the mini, to make sure that they were eligible to participate in that, they had mild to moderate levels of depression or anxiety. They were then randomized to either this treatment as only group, the control group, or treatment as usual, plus this web-based intervention. So just in relation to the findings. Now, while the numbers are small, what we actually found was that when we looked at PHQ-9, which measured depression, and the GAD-7 scores, which measured anxiety, we found that there was a significant decrease in both depression and anxiety scores between time 1 prior to taking the intervention and time 2 after the intervention among those who had actually received the intervention, whereas no significant difference was found among the control group. When we asked them about the feedback, asked them for feedback rather on the intervention, there was quite a lot of positives. They said that it was easy to follow, they liked the regular feedback, they found the techniques helpful, and that it was practical and informative. And many said that they felt that it improved their mental health and was particularly good for students who might be sitting on waiting lists for a long period of time. And there were also negatives, however. Some felt that the platform itself was hard to navigate, that there was definitely teething problems. We had slow loading times. And some felt that it was too impersonal, that there was a lot of reading and videos, etc. Although I have to say that we actually added in the videos after feedback from our original PPI advisory group. And some again said that they felt that it was time consuming and that they didn't believe it would have lasting benefits. So we are continuing this work, and we're currently pulling together a 6-month follow-up, and we'll hopefully be able to present on that in the future. But one of the big things, I suppose, that we did find for this was when we applied for the grant, we felt that something online would be really beneficial for students, in that some of them were saying that they didn't want to go to the traditional services within the university. Unfortunately, by the time this started, we actually were in the middle of the pandemic and all teaching was online. So the novelty certainly had worn off at that stage. So thank you for listening to me. I just want to acknowledge the team involved in this, especially Dr. Elaine Murray, the PI on the project, and all the other co-investigators, and in particular as well to Natasha Brown, who's my counterpart in LYIT, who's on here today, and our PhD student researchers. So thank you so much for listening to me, and I look forward to the question and answers later. This is my email address. if anybody wants to contact me directly. Thank you.